The pro, so let's bring her to the stage and give her a warm, loud welcome. Meredith.
Thank you. Good morning, everyone. Thanks to those of you who stuck around. Can you hear me? Holding it down. I heard I missed a fun night last night. As I mentioned, I am a Park City local. It's really rare that we get any sort of media events here, so super excited. Hope you guys enjoyed enough the hiking, golf, biking to come back, because I would love some more media folks in town more permanently. I'm not here to talk to you today and sell you on the Park City lifestyle. I'm here to tell you about Dstillery's custom patient targeting solution. Dstillery, we are a custom audience solution company for those of you who aren't familiar with us. We've been around about 12 years now. We started in 2009, and we really have had at our core custom audiences. We're a custom audience content company, and really we're backed by data science and machine learning. In our early days, we had our own boutique managed service DSP, and we got a lot of questions and demand from the marketplace to activate our top performing custom audiences anywhere. So we actually ended up sunsetting our DSP, decoupled our audiences, and really allowed our biggest brand partners, about 2,000 brand partners, to activate those audiences anywhere they want the DSP and social network of their choice. In Q4 of 2020, we realized that a lot of our audiences were reliant on third-party cookies, and we actually started building out a post-cookie solution before Google officially announced the retirement of the third-party cookie. We launched our ID-free targeting solution at that point in time. ID-free is not a contextual solution. It's not a new identifier. It's a way to target without any reliance on third-party cookies. And when we started launching that in the marketplace, we received a lot of demand and interest from our healthcare targeting partners, just based on the nature of that product, because it was privacy by design and compliant. Our healthcare partners were really raising their hands, interested and excited to activate ID-free. So we actually ended up creating a flavor of ID-free specific to our healthcare partners, which is what I'm going to talk to you a little bit about this morning. And that is called our custom patient targeting powered by Dstillery's ID-free solution. So when we launched this, we really received a lot of attention immediately and interest from these brands. As you guys know, every single day there's a new identifier being released. There's a lot of noise in the market. So custom patient targeting was solving for a problem that I believe many of you are really familiar with, is how to create targeting at scale for healthcare and pharma clients. And bear with me, I couldn't mic up here. So healthcare brands want to achieve more precision, direct-to-consumer targeting, but face really strict data requirements. Things you guys are all familiar with: HIPAA compliance, NAI guidelines, the DSP rules and limitations, first-party data limitations, and then strict demographic requirements. So I want to introduce you to our custom patient targeting solution. Because of these limitations in the marketplace, these requirements have really created for you fewer, narrower options, which has ultimately cost you time, money, impressions, and most importantly, conversions, reaching people who aren't your prospective patients. And really what our goal is to achieve for you is less waste and more precision. So custom patient targeting will help to solve your healthcare targeting needs by future-proofing your targeting strategies. It's a privacy-safe patient targeting solution that helps healthcare brands to drive optimal patient outcomes with less waste. So when you're sitting back on your planes to New York, Chicago, Boston, anywhere else I missed that you guys are from, I want you to remember three things about custom patient targeting. First of all, it's precise in that it drives your optimal patient outcomes with minimizing waste. It's custom built just for your condition. And then lastly, it's compliant. So it is 100% compliant with all of those guidelines, HIPAA, NAI, and any of those DSP rules. So it is precise in that we're going to start with your brand or your condition at the core. It's custom in that we don't take a one-size-fits-all approach. We're going to create for you a custom model based on just your condition, and it's compliant in that because we're not using any user-based targeting and we're not using any identifiers, it's 100% compliant with any of those regulations, the DSP rules. We've gotten the blessing from the DSPs from both their legal and policy guidelines, and it's ready to activate today. So I'm sure you're asking yourselves, how does this all work? So first, we're going to start by defining your custom seed set, and we can work with your teams to define that. We can use first-party data. We can use health and pharma search keywords. We can use NCD-10 codes very soon, and we're also working to roll out claims data. So based on what your goal, KPI, and outcome is, we're going to customize the model for you. We're then going to learn the patterns and behaviors that are unique and nuanced to your brand and your condition alone, based on viewing those anonymous opt-in devices that we've identified in your seed set. We're then going to build out our custom model. So we're going to scale out to the entire addressable internet. We actually have built out as a piece of ID-free what we call MODI, which is our map of the internet, which is a 128-dimensional neural network map from opt-in panel data that allows us to identify how consumers and how patients are journeying the web, what is unique about them, and when we overlay your first-party data or that seed set, we can pull out those unique attributes that make your brand or your condition unique, identify 3 key attributes, website, URL, and time of day, and how those are scoring, and create for you that custom model. And then we're going to target your patients. So this model is going to be refreshed and rescored based on your condition, and we can actually rejigger it based on your KPIs to target your patients in the DSP of your choice or network of your choice. It's really easy to do and set up, and with just some feedback from you on what that seed set is, we can go ahead and activate that and set that up for you. So when we launched this, we started seeing pretty early success, and as I mentioned before, this isn't a contextual solution. It's not a new identifier. And our first healthcare brands to test this tested custom patient targeting against a number of other tactics. They tested against contextual solutions, some ready-in-market healthcare solutions, and then custom patient targeting. And what we saw right off the bat is that it lowered the CPA for this rare disease condition by about 84% when compared to contextual targeting. So CPA is better here, so we want lower. And it also allowed them to create about 3x the scale. And as I mentioned before, scale has been a real challenge for healthcare brands and partners historically. So we were super excited to see those early results and adoption. And we're working to continue to rejigger our models to be able to outperform any of the current solutions in market, and most importantly, continuing to outperform those contextual targeting solutions. So this is relatively easy to set up. The first thing is that we're going to create either a custom bidding algorithm for you to be activated in the DSP of your choice, or another preferred activation method can be via deal IDs, so making it really, really seamless to set up. We're going to select those seeds and outcomes, and again, customizing and tailoring that to your specific condition. Then we're going to build and deploy that custom model. From a testing recommendation standpoint, we want to clearly establish what those outcomes are, whether it's prescription lifts, KPIs such as site visit or cost per action, because we're going to tweak and customize that model just for your specific condition. We have a dedicated data scientists and white glove service to be able to help you with campaign activation and setup, so that as we're going throughout the flight of the campaign, we can customize that specifically for you. And then we want to provide for you that precise, scaled performance option to ultimately help you increase your programmatic budgets without any waste. The biggest thing to wrap your heads around, and what I want you to take away today, outside of that it's precise, it's customized, and it's compliant, is that we're not targeting a bucket of things here. We're no longer targeting a bucket of cookies. This isn't a new identifier. It's an easy way of targeting on any DSP or any platform, and it's ready and available today. Any questions?
Wow, that was awesome. First of all, big round of applause for